You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Welcome. This is Detailing Addiction. I'm Dr. Susan Blank, and you're listening to America's Web Radio. Today in studio, I have with me David Donaldson and Michael Daly from the Atlanta Healing Center. Hi, guys.
Hello.
Hey.
We all made it. It's a good sign. It's a good day. We're going to have a good show.
Got some amazing traffic in Atlanta.
Amazing traffic and amazing heat. So for those of you who may be watching us on Facebook Live or on the website, americaswebradio.com, you may be really surprised to see how much we're sweating. And now they're making us sit closer together as if this wasn't bad enough.
We have bathed.
We have bathed, but it's been a while. Today, our topic, I think, is a timely one, and that being we are headed now towards a big drinking holiday. One of the bigger ones of the summer, probably not as big as Labor Day, but pretty darn close. And because of that, we wanted to really focus on what's addiction treatment, what's recovery, and this kind of came out of a conversation that I've had with several patients over the last couple of days about the idea, is detox treatment? Or why do I need detox? Why can't I just come into treatment? Why do I need to go inpatient for a medically managed detox? So I thought we probably ought to start with those two questions and help our listeners understand a little bit more the importance of detox, but the fact that it's not really treatment.
But and part of why I think it's so important is so many patients, when they do go to detox, will get out of detox, and truly they're still in the detox process. The detox lasts for quite a while.
Well, and sometimes, David, to that point, there's more medication in them than what they. I mean, if they're there for alcohol, they're now on Librium or something, which is equally as
Impairing.
And they don't realize that that's the way they're going to be released.
But and real often they will be set up because their family members will view them as they've just gotten out of treatment, and they'll even be upset that we've paid for treatment 5 times and it hasn't worked, when in reality what they've paid for has been detox.
Right. So that is very, very important to understand that there are times when, because of the drugs or alcohol or other substances that a person may be using, that there is need for medical supervision and sometimes 24-hour-a-day medical supervision to make sure that they do that safely. When a person comes out of that, we're going to talk a little bit more about what that is in a moment, but often, to you guys' point, when you come out of that, you feel a lot better. You've been rehydrated, you've been fed, you've gotten to rest, you've been given some medication to take away some of the symptoms of withdrawal, to help you with sleep or to help you with anxiety. And because of that, your family thinks you're okay, often the patient thinks they're okay, and it's not for some days later before the reality sets in that I'm not okay. I may still be having withdrawal symptoms. I may still be having cravings. I may still be unsteady on my feet. I may still be cognitively impaired. I may not be ready to go back to work or assume my responsibilities.
And you just shouldn't be driving.
And you shouldn't be driving. And there are all of these things that sometimes come too late in terms of realization when recommendations are made for them to continue care or to go to another treatment program to continue with what real treatment is after detox. Often at that moment when that referral is being made, the person does not appreciate how important that's going to be enrolled in a program and have the next warm handoff, that they are now engaged in ongoing support and recovery process.
Well, a lot of times I'll have a photo on call. They'll talk to me about the situation with their patient, identified patient, and they'll be trying to figure out when to get them, say, to detox. And I try to help them count backwards from the time that we can make an appointment at the Atlanta Healing Center
Right.
to see you, so that it's seamless. Getting out of detox means the day that you get out, you go directly to an appointment with your provider, your treatment provider.
Right.
So they can manage your medicine, your all the different things that we were just talking about, but you know the doctor's order for much of that.
So hopefully when you're leaving detox, you're going directly to either inpatient treatment or outpatient treatment, but someplace where they're going to be able to continue to medically monitor the process.
And make sure that the symptoms of withdrawal are abated, that a lot of the physical needs that may have been identified while you're in detox are able to be addressed, and that you are able to now really begin your recovery process.
And I think right here would be a good time for you to tell us about the various drugs and about the need or necessity for detox, because truthfully, I think that people oftentimes have it all completely backwards.
And that is very true, Michael. One of the things that most people, and honestly many healthcare professionals, don't understand is that while I wouldn't wish heroin withdrawal on anyone, because it is very miserable, it's uncomfortable, you're not going to die from that.
Nope.
You might wish you could, because
Right.
you feel bad, but you're not going to die. Your life is not in jeopardy. Stopping alcohol, stopping benzodiazepines or barbiturates, which are pretty rare these days, but are sometimes found in headache medication like Fiorinol.
That's the barbiturate.
That's the barbiturate. These are physically dangerous in withdrawal. These are the ones that we spend sleepless nights worrying about patients who are out there not being medically managed.
Right.
This is so serious, and many times patients will say, well, I can do this at home. I can stop drinking. I'm just going to stop.
Well, and real often they will say, I stopped 2 days ago and I feel fine.
Right.
Which is the magic word.
Yes. They feel fine. But
In 2 days, because it's...
Right, because they actually feel better. Some of the toxin is out of their system. They've rehydrated themselves. They've probably had something to eat, and they do feel a little bit better. But when they walk in our doors 2 days after they stop drinking, what we see is that often their blood pressure is very high, their body temperature is high, their heart rate is high, they've got a little bit of a tremor, which they may not even be able to see, but when we evaluate them, we can feel it.
Mm-hmm.
They're often sweating. They
Right.
may have a headache, nausea, vomiting, creepy crawly feelings on their skin, sensitivity to light and sound. These are the symptoms that say, okay, you are headed for a sympathetic nervous system explosion. And by day 3 through 7, this is the really critical period of time for stopping alcohol or benzodiazepines or barbiturates, because this is the time when you are really at risk for seizure.
Mm-hmm.
And then if this continues without medical intervention, and very rarely, but even with medical intervention, people develop delirium tremens or the DTs,
Mm-hmm.
and you can actually die from that. So We are very well aware of a recent death, fortunately not one of our patients, but unfortunately a person that we're acquainted with who decided they were going to stop drinking. They ended, and this was a young person in their late 20s, early 30s, decided to stop drinking, going to just stay at home. They were found in a coma, taken to the ICU, and later died. So when we say you need medical evaluation and help to stop drinking, we are really serious about that. And it doesn't mean everybody needs detox, doesn't mean everybody needs to be inpatient, but with those 3 drugs, it does very much mean that you need to have someone who understands what withdrawal looks like and who can help you get through it safely.
Right. Now, is there a scale or a some form or guide that a medical provider would use?
Yes, it's called a CIWA, and it is capital CIWA. And this is a clinical scale that allows us to rate how severe a person's withdrawal symptoms are. And this is standardized. We use them at the hospital. We use them as an outpatient. We often send home a copy or 2 of this for the patient and their family if we're doing an ambulatory detox, so that we're able to guide them about when, okay, this is uncomfortable. This is when you need to take some medicine. This is when it's getting more serious. You need to call us. This is when you need to head to the nearest emergency room, or this is when you need to be dialing 911.
Right.
And we spell that out very clearly, in addition to giving them information about when and how to take medication. So that is if someone is medically stable, they're only using alcohol or only using a long-acting benzodiazepine. There are lots of...
And they have another person that's there with them to make sure they're safe. Because if they're having a seizure, they certainly can't help themselves. But seizures is just one of the possible medical complications of detox that could be fatal.
And not to muddy the waters, but when we were talking about the opioid, it was always very surprising, or it is always very surprising, when you get someone that is, their main drug is opiates, heroin, but they're also taking Xanax.
Right. And then we've got a real problem. We're going to take a break now. When we come back, we're going to talk about what that real problem is. Please stay tuned.
The disease of addiction is a life-altering challenge, not just for the person suffering its effects, but also for the family and friends who support and love the one caught in its grasp. What should be the course of treatment? Who is the best person to render treatment? And what is the best place to go for the care that is needed? We know that you want answers to these and many more questions. Call 770-696-9862 and speak to a representative of the Atlanta Healing Center. They can tailor a program specifically designed to address the needs of the person suffering with an addiction, or give you guidance as to where that help may be found. Information is the key, and the trained staff at AHC is here to assist. If you wish, you can also get more information on the website located at www.atlantahealingcenter.com.
This is Ron Camacho, host of the Business Hour, on Fridays from 10 to 11 a.m. Join me as I talk with passionate professionals on a program that profiles the best businesses, business practices, and fascinating business professionals to get an insider view of how America works. The Business Hour from 10 to 11 a.m. on America's Web Radio.
Perhaps you are struggling to cope with the disease of addiction. If not, you probably know a family member or friend that needs help in battling the cravings and the personal and professional damage done by the effects of drugs or alcohol. Get a pen and paper and be ready to write down the following. These are the issues that the trained staff at the Atlanta Healing Center address and treat every day. Their doctors and counselors with over 40 years of practice in the field of addiction can treat the suffering individual in a thoughtful, compassionate, and experienced manner and guide him or her along the path to recovery. So call 770-696-9862 and speak to a knowledgeable staff member about how you or your loved one can be helped to enjoy a better and healthier life. More information is also available on the website at www.atlantahealingcenter.com.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Welcome back. This is Detailing Addiction. I'm Dr. Susan Blank, and you're listening to America's Web Radio. Wanted to let all of our listeners know that we are being broadcast live on Facebook Live if you're interested in seeing what we look like, and also if you're interested in sending in some comments or questions, we'll do our best to try and address those, if not in this particular segment, at some future time. So you go to the Facebook page for America's Web Radio, and that's where you would see our Facebook Live as we are broadcasting. Right before the break, we were talking about the detox that is needed for alcohol, benzodiazepines, and barbiturates. So this is going to be one of those detoxes that I'm going to draw a really firm line for many people, because many folks, unfortunately, have had previous seizures. They may be using multiple medications. They may have medical complications such as liver problems related to their alcohol use. They may have other
blood
kinds
pressure issues.
Right, that are not stable, and it is not safe, and they need the 24-hour care. And as well-meaning as their family may be, and we don't want a family member having to deal with someone having a seizure. No. So we are really cautious about that. Not to say that we don't do it, because occasionally we do for a young, healthy adult using a single substance that we have verified, by the way, with our urine drug testing to make sure that we're not complicating or setting up that person to have a dangerous withdrawal. Mm-hmm. Right before the break, Michael, you mentioned one of the very complicated patients, which is someone who's on an opioid. And remember, I said coming off heroin, while very uncomfortable, and sometimes there are also reasons that that person may need to go inpatient and detox. Mm-hmm. One of those reasons would be if they were also drinking a lot or taking a benzodiazepine, like Xanax or Ativan or Klonopin. These medications need to be tapered. Those need very significant medical management, as does coming off the opioids. And you need to have a place that understands that and knows how to deal with multiple substances, certainly with the sedative hypnotics and the opioids. So that's one that we would also very likely refer for a higher level of care for detox.
But and part of why that's so crucial is if, because you're a person who is going to go someplace where you can use your insurance and the place is driven by an insurance model of treatment, if you just tell them heroin, they're going to refer you to an outpatient counselor or to an outpatient group, and they're going to tell you you're going to feel really miserable for 3 days, but you'll be fine. And they won't be able to justify the inpatient admission unless you include the alcohol and the benzos and the things that make it more risky.
Right. And that's really very important. The other thing that would distinguish whether or not we would handle it as an ambulatory detox would be how significant are any co-occurring psychiatric disorders. Mm-hmm. So if the person is acutely suicidal, and sometimes people have reached the end of their rope, the consequences have mounted, bad things have happened, they're not calling us and saying, my life's going so well, Michael Daly, I'd like to just come in and go to rehab. Yep. Usually there's been something significant that has occurred, and because of that, they're really at risk for not only contemplating contemplating suicide but actually making a suicide attempt. So that's one of the things that we would screen for, and if that person, regardless of the substance they were using, is acutely suicidal or homicidal, thoughts of harming someone else, those folks we would refer to a higher level of care because of the instability of the psychiatric disorder.
Well, and there's a means for you to take care of that when a person has that diagnosis and does not want to go into treatment.
Right, and this is one of the few times that if I saw someone, they were suicidal or they were talking about specifically hurting someone else and they didn't want to go to treatment, I have the ability to place them on a 1013, which is an involuntary commitment, and they would be hospitalized in a psychiatric facility that would be locked for at least 72 hours while they were stabilized. We don't use that very often, pretty rare in fact, but it is possible. Sometimes families will say, well, my loved one doesn't want to get treated for their alcoholism or for their heroin addiction. Can you force them into treatment? The answer is
No.
probably not. There is also a 2013 in the state of Georgia. Each state has their own number system for this kind of procedure. In Florida, for example, it's called the Baker Act. So you might be Baker acted into treatment. But here in Georgia, we have a 2013, which can force somebody in treatment involuntarily for substance use disorders. But the caveat for that is not just you've got it really bad and you don't want treatment and your family's upset. No, you have to have a life-threatening illness such as you're in DTs or you just had a seizure or you're in liver failure and you're going to die right now, not theoretically sometime in the future, but you're going to die right now unless you get treatment for your addiction. I've never actually had one of those be successful, but in theory, that is possible. The other situation is if someone is psychotic, where they're hearing voices, they're seeing things, they're paranoid, they're believing things that aren't true, and because of that, they have a level of confusion or a very negative reaction to treatment, to being compliant, to showing up, to taking their meds, that person would not be a candidate for an ambulatory detox. It's just not safe, and they need to be in a situation where medication can be given to them and they can be monitored very closely.
So that person we're most likely to see if they've been using spice, if they've been using some of the more high potent THC, if they've been on crystal meth, things that really disrupt their sleep cycle and also their brain's ability to be clear with what's going on in the world.
Right. Or they may have a bipolar disorder that is unregulated because of their drug use, and they may be having a psychotic break because of that. Or they may have schizophrenia. And so these would be relative contraindications for someone to be detoxed as an outpatient. Again, because safety first, always safety first, and we have to think about that, even though sometimes it's not what the person wants or their family wants. That is a situation that we have to be really very careful about. Also, if someone is acutely demented, they would not be a candidate for outpatient detox. I think I've got pretty much
I think
all
that
of them.
you've gotten it.
Yeah.
I was thinking though, in terms of that confusion people have between detox and treatment.
Right.
Part of what happens at most detox centers is that real often they are connected to a psych center unit. So they will see a counselor while they're there. They will probably attend some groups. They might have members from the local AA community come in and do a 12-step meeting. So they are having kind of the experience of treatment, even though it's not actually treatment. Actually, what's happening is that they're being monitored closely.
Kept busy.
They're having their vital signs checked. They're being medically monitored, but they're also being entertained. And they are not having treatment. Their brain actually doesn't even have the capacity to absorb what's happening in these situations while they're going through this. So even though it seems like treatment, it is still just detox.
Right.
Correct. So we do ambulatory detoxes, and again, for some uncomplicated alcohol as the dopamine releaser of choice, some very uncomplicated benzodiazepines. But probably our most frequent medication substance that we would do an ambulatory detox would be for an opioid. Mm-hmm. So sometimes we get referred patients from pain practices where they don't really have addiction, but they have been taking their pain medicine. Now their pain problem has resolved, but when they try and stop their medicines, they go into withdrawal.
Right.
So sometimes we are doing a medication taper. We do not call that a detox because detox is associated with the diagnosis of addiction. We call that a medication taper. So that we do probably over a 12 to 16 week period of time, very, very slowly, with the idea that they're going to come off of the medication and hopefully live a pain-free, happy life after that. Many of our patients have been using pain medicines. Sometimes they have a pain problem, but many times they're using it to treat things other than their pain issue.
Like emotional
pain, for recreational uses, like heroin or some of the very potent opioids. Mm-hmm. And this is a candidate who would be ideal for an ambulatory detox. Again, if they have a responsible family member that can drive them back and forth to our clinic for a few days, that can help monitor their medication and can help report back to us if in the off hours there's any kind of difficulty or problem. Mm-hmm. The patient needs to be willing to come in every day for at least 3 to 5 days and to be actively participating in their detox. This, again, is an ideal candidate for which we could use medication-assisted recovery, which we will talk about when we come back after these messages. Thanks for listening.
Perhaps you are struggling to cope with the disease of addiction. If not, you probably know a family member or friend that needs help in battling the cravings and the personal and professional damage done by the effects of drugs or alcohol. Get a pen and paper and be ready to write down the following. These are the issues that the trained staff at the Atlanta Healing Center address and treat every day. Their doctors and counselors with over 40 years of practice in the field of addiction can treat the suffering individual in a thoughtful, compassionate, and experienced manner and guide him or her along the path to recovery. So call 770-696-9862 and speak to a knowledgeable staff member about how you or your loved one can be helped to enjoy a better and healthier life. More information is also available on the website at www.atlantahealingcenter.com.
Hello, I'm Dr. Mike Karuchak. Have you ever wondered what doctors talk about amongst themselves? If you do, join us on the Doctor's Lounge and hear the doctors' conversations amongst themselves. Join me and my co-host, Dr. Hal Schertz, every Thursday morning, 8 to 9 a.m.
The disease of addiction is a life-altering challenge, not just for the person suffering its effects, but also for the family and friends who support and love the one caught in its grasp. What should be the course of treatment? Who is the best person to render treatment? And what is the best place to go for the care that is needed? We know that you want answers to these and many more questions. Call 770-696-9862 and speak to a representative of the Atlanta Healing Center. They can tailor a program specifically designed to address the needs of the person suffering with an addiction, or give you guidance as to where that help may be found. Information is the key, and the trained staff at AHC is here to assist. If you wish, you can also get more information on the website located at www.atlantahealingcenter.com.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Welcome back. This is Detailing Addiction. I'm Dr. Susan Blank, and you're listening to America's Web Radio. Or you're checking us out on YouTube, or you're checking us out wherever you source your podcasts, or you may be on the America's Web Radio Facebook page and watching us on Facebook Live. Hopefully, you've picked one of these options and that you'll continue to give us some feedback. If you have questions, if you have topics that you would like to suggest, we may not be able to answer them live during the show, but we will certainly consider and try and have them as a future topic. So feel free to source us any way you can. We're happy to have you as listeners. Right before our break, we talked about medication-assisted detox, which we often use buprenorphine products or naltrexone or other substances to help the person come off of the medication. That's only one way that we might do that. Sometimes we do medication-assisted recovery. And this is where we begin to talk about treatment, not just getting the person off of the opiates or off of marijuana or off of alcohol, benzos, any of the other substances, but we're going to actually begin treatment.
Can I mention something here?
Yes.
I talk to so many people that have gone to a detox center where it's a 5-day detox for opiates. What they use at the center is Suboxone generally, and they're given, I think, their last dose of about 2 milligrams.
Mm-hmm.
They're told that then they leave on day
With
5
nothing.
with nothing else, and they're expecting to be happy, joyous, and free.
Correct.
But that's not what happens.
Right. They're happy, joyous, and free for about 2.5 days.
Exactly.
Or so.
Or so, sometimes less than that. But what happens is, to your point, Michael, is in our philosophy, the addiction treatment according to the Atlanta Healing Center, when you're at 2 milligrams, you're only halfway done. And so very often we will see the person you mentioned discharged. They took their last dose of 2 milligrams that morning, and they go home and think, I've got a new life, this is wonderful, and then they show up in acute opiate withdrawal. And often we have
Very
to have
sick.
a discussion about what to do next. And part of that may be to put them back on the Suboxone, either continue a gradual taper. At 2 milligrams, it will take at least 6 weeks after that to gradually taper it down so that they are comfortable in that process and able to manage their life. Sometimes longer than that.
Right, because sometimes they want to come down. They say,
Right.
as quickly as possible. So you try to do a 6 or 8 week taper. Well, you get to the second step down,
Right,
and then all of a sudden they're going, wait, back up.
right.
I think I'm going a little too fast. And we try to help them understand that, yes, you probably are.
probably
so let's
are.
back up.
I actually had read a physician in Florida whose practice really is about Suboxone tapering, and he's the same philosophy. When you're at 2, you're only halfway there. But another piece that I've really come to believe is incredibly true is that if they're smokers, he gets them off of nicotine before he'll even think about trying to get them off of the Suboxone, because what he says is they just can't do it. The pain is so much worse if they try to keep smoking while they're quitting Suboxone.
It's amazing that combination has been identified, and now that you've identified it and talked about it, we've seen that exact thing.
Show up. So sometimes people want to come off, and we go gradually. We like to help them set goals, but we also want them to be realistic and understand that we will move at their pace, because sometimes real life intervenes.
Absolutely.
During this time, though, they are beginning treatment. We don't just do detox. We don't recommend that you go inpatient just for detox. We don't do detox. Sometimes we do medication taper for the chronic pain patient without addiction, but we don't just do detox because that is not treatment. Detox is not treatment.
Absolutely.
What we need to begin to do is all of the medical, metabolic, cognitive, psychosocial assessments to understand what these individual needs are and how can we best help the whole person and their family, whatever and however they define their family. So it begins the process. They will have assessments. They may meet with David or with Paula. They'll have a brain map. They'll do neurocognitive testing. They'll do more blood work. Yes, they may have done some blood work while they were inpatient, but it's not nearly the amount and the type of blood work that we want to do.
But we don't replicate it necessarily.
No.
So, I mean, it's not like they've just wasted.
They're paying twice.
Yeah.
Right. And we began to introduce them to recovery principles. They begin to go to groups. They begin to have education sessions. Family programming is very important. Individual sessions with their addiction counselor, very, very important. Times to meet with me to discuss their psychiatric and their medical and their hormonal and other kinds of issues. So this is where we begin treatment, and we begin to talk to them about their recovery plan ongoing and help them introduce to concepts like 12-step programs.
Right.
Or
smart
other
recovery, or any other type of a program that they can join, and it's ongoing to help them make it
But
long-term.
in the treatment groups themselves, it's not that they're just replicating AA meetings with feedback.
No.
AA meetings are places where they go and share, and then they listen, and they don't give each other feedback. And so people think, well, a therapy group is like an AA meeting with feedback. But no, it's so much more than that. It's looking at your barriers to the recovery process. It's looking at motivation enhancement. It's looking at the issues from the past that continually trip up your process. So it's much more of digging into. It's being willing to experience vulnerability with a group of people and have the support to deal with it. You do get some of that with AA.
Sure.
But it creates actually artificial relationships because you're learning so much about people really quickly, and you're learning how to experience feelings in a supportive, caring way that are supportive and not violating. So hopefully you can take that into your real life. But it's so much more than just AA meetings with feedback.
Right. And the idea that you're actually building skills, that you're learning what are some of the triggers that make me want to use, that make me crave, and what are the ways in which I can intervene and intervene more quickly, recognizing things sooner and getting out of trouble faster. That's part of the goals of what we need to do.
It's always really interesting. I just have to interject here real quick. I'll get a lot of people that when they sign up, they're like, oh my God, 8 weeks of group, 3 times a week for group, and then the 4th with the family. Oh, there's so much group. I don't know if I can do it. I hate groups, blah, blah, blah. And then about week 6,
Right.
that person that hated groups and that was anti this and anti that comes to me and says, do you think that we can come up with a package of more time, and I'd like to include some groups into that.
It is always very interesting, and the psychology of getting people engaged in treatment is very interesting. But there is something magical that usually happens for most people around 6 to 7 weeks when their brain is really cleared, a lot of things have rebooted, and they begin to really value not only their recovery in their life as it is, but their family and things that were important to them in the past. And it's at that point that we can really see them begin to move forward and begin to make some really good strides. And they need to continue. They need to continue with support. They need to continue with therapy. They need to continue with a lot of things. And one of the things may be medication-assisted recovery.
Right.
So we've talked about detox, but sometimes we have patients that have been through detox, that have been through multiple treatment episodes. And
Of inpatient
or even outpatient. And we realize that in order for this person to be successful, then we need to do the David Donaldson method of keeping them on the Suboxone, the buprenorphine product, for at least 13 months.
Right.
And at that time, then we reevaluate and see if their life is stable and that this is a good time for them to begin tapering down, or do we need to wait a little bit longer? Because truly, heroin, fentanyl has changed the scene and has changed the way we view what we need to do to help people stay sober and stay safe and not die.
It's the truth. Just one thing real quick. When we say 13 months, that's not 13 months of continuous treatment. I mean, it's 13 months of medicated assisted recovery. But the treatment by that time has
Tapered down.
tapered down.
Right.
So it's not as if we've kept you in
Right.
Lock up.
In purgatory.
for 13 months.
No, as the person, and it is individual.
Absolutely.
It is individual depending on the level of progress, the complications that are in their life, and the individual things that they may need. They may need more neurofeedback to help with a head injury. They may need more individual counseling to help them with skill building. They may need family therapy. They may need more medication and hormone management. It's not one size fits all, and that's the other important thing to understand about treatment is truly it needs to be individualized. It's not just a program that you show up and you check off the boxes and you get your certificate of attendance. This is really, what do you need to be safe, sane, and sober, happy, joyous, and free? And we're going to take a break now. When we come back, we're going to talk a little bit about the differences between treatment and 12-step recovery.
The disease of addiction is a life-altering challenge, not just for the person suffering its effects, but also for the family and friends who support and love the one caught in its grasp. What should be the course of treatment? Who is the best person to render treatment? And what is the best place to go for the care that is needed? We know that you want answers to these and many more questions. Call 770-696-9862 and speak to a representative of the Atlanta Healing Center. They can tailor a program specifically designed to address the needs of the person suffering with an addiction, or give you guidance as to where that help may be found. Information is the key, and the trained staff at AHC is here to assist. If you wish, you can also get more information on the website located at www.atlantahealingcenter.com.
Live closer to your food source. Learn how to grow it yourself. Please join me every Saturday morning at 10 Eastern on America's Homegrown Veggie Show for tips and advice from the country's best gardeners.
Perhaps you are struggling to cope with the disease of addiction. If not, you probably know a family member or friend that needs help in battling the cravings and the personal and professional damage done by the effects of drugs or alcohol. Get a pen and paper and be ready to write down the following. These are the issues that the trained staff at the Atlanta Healing Center address and treat every day. Their doctors and counselors with over 40 years of practice in the field of addiction can treat the suffering individual in a thoughtful, compassionate, and experienced manner and guide him or her along the path to recovery. So call 770-696-9862 and speak to a knowledgeable staff member about how you or your loved one can be helped to enjoy a better and healthier life. More information is also available on the website at www.atlantahealingcenter.com.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Welcome back. This is Detailing Addiction. I'm Dr. Susan Blank. This is America's Web Radio. And with me today are Michael Daly and David Donaldson from the Atlanta Healing Center. We have made you aware of our new social media presence, and we're very grateful to America's Web Radio for providing a variety of options for you to be able to access our broadcast as well as other important podcasts that other providers on this network do every week. So you can go to America's Web Radio Facebook page and see Facebook Live. Wherever you source your podcasts, I wanted to say a particular place, but I'm going to say podcasts. You should be able to find Detailing Addiction with Dr. Susan Blank. And certainly if you want to watch live from America's Web Radio's webpage, you can do that. Or you can just follow us on our website. Mm-hmm. With our blogs that announce what our topics are, and then you can go back to the archives if there's something that's interesting to you. So with all of that being said, we were talking about medication-assisted recovery, and one of the important things is that it is individualized, and sometimes people do stay on a variety of medications. Mm-hmm. So we have 3 different types of medications that are approved for opioids. We have 7 that are approved for nicotine addiction. We have 3 that are approved for alcohol, and then some others that are used off-label. Mm-hmm. So we have lots of options, including also treatment for psychiatric disorders, depression, anxiety, and so forth. So this is going to be going on while we are assessing you, while we are supporting you in active treatment. As you begin to progress and develop your coping skills, we want you to become engaged in a support network in the community. Mm-hmm. And this is something that is often talked about in individual, in group. Other places will have this discussion, because as you decrease your attendance at programming at Atlanta Healing Center, we want those hours and times filled with your community recovery support. So the other important thing we need to say is, just like detox is not treatment, 12-step programs or other self-help groups, very important to maintaining recovery, but they are also not treatment.
Right.
Absolutely, and they are crucial.
Yes.
For a lot of reasons for your ongoing recovery process. You know, as we were talking about the treatment experience, you're digging in and you're learning about relapse prevention and motivation enhancement and all of those different things. But the community support recovery is giving you the opportunity to develop new supportive, caring relationships, to really rebuild your to break the isolation that addiction creates, right, which is so crucial, whether it's in AA or NA or CA or SMART recovery, or refuge recovery. It's getting you out of the isolation that addiction created, and it's helping you start to build sober, clean, fun relationships.
And the fun is really important.
Absolutely, because I always tell people, look, you know, you wouldn't see people with multiple years if they aren't having fun.
Right.
Because we just don't do that. I mean, we're addicts and alcoholics, and we're used to having, air quotes, fun.
Right.
So you have to have fun in sobriety.
And it's nice to know that not only is this an important part of your recovery, but it's free. Mm-hmm. It is available, and here in Atlanta and in other large cities around the country and around the world, it is available 24/7. Because
yes.
we now have online groups that people can attend. We have meetings. The important thing is not just the meeting, though. The important thing is working the steps and working with a sponsor. So however that work gets defined by whichever mutual support group you're using, that is the important piece. That is where the change really takes place in terms of how you view yourself, your relationships, and your world. And this is where you really begin to understand the skills that you need and developing that capacity for rigorous honesty with yourself and often with the people around you. This takes time. It's part of a process, and it's a wonderful way in which people can really fill out their life and have
true sobriety.
Correct.
Not just being dry or drug free. There's a really big difference.
Part of what strikes me is that most adults in our society drink. There's a large number of people in our society that have a drink every day, and they're not alcoholics.
Right.
And so for the people who are alcoholics, who are getting out of treatment and learning how to live in our society, the addictive center of the brain is sitting there thinking, how can I drink normally? How can I be like the rest of these people?
Right.
I'm sure I just had some stress, and that was the only problem, but now I can go hang out with my friends and I'll be fine. And we know this is a genetic disease, and you won't be fine. If you start having one drink, you're going to go back to your pattern. But if everyone around you is able to have one or two drinks without problems, you're going to start feeling really angry and isolated.
And resentful.
In the middle of a crowd.
Especially at the 4th of July, when
Right.
everyone else is having probably more than one drink. And so developing at AA and at Smart Recovery and these various fellowships, people that you can hang out with where you don't have to worry about, are they going to drink in front of me, and do they care, are they supportive? And you can just relax and learn how to be yourself.
Well,
and they accept you. There's no judgment. These are people you don't have to explain. They get it.
Mm-hmm.
They're welcoming, and all they want to do is help you stay sober. And that's a beautiful thing.
when you first walk in that program, because I've done it, you're kind of thrown back by all these people coming up to you and offering their telephone number, their help, their meeting schedules, and you're
A ride
overwhelmed.
to a meeting.
Yeah, but you learn quickly that these folks are the same ones you'd be hanging out with
At the bar.
at the bar.
Right.
They're just not drinking anymore, or they're just not using anymore. So that preconceived idea of, this is a group of, little do-gooders or whatever it is, it's not true.
Right. And they have also learned to have as much fun.
Right.
So just like we say, detox isn't recovery. It is a crucial step for most people. 12-step fellowships or other recovery networks are not treatment, but they are critical.
Yes.
The other piece of treatment is that this is a chronic illness. And because of that one episode of treatment, while we hope and pray that's all you'll need, is often not all you need. And so staying in touch with your addiction treatment providers to help you get through stressful times. Maybe you have to have some surgery. Maybe you've had an injury or an illness. Maybe you've had a slip. You are able to come back and be welcomed, figure out what went wrong, make some adjustments to the treatment plan, and help you get on with your life.
Right.
So that part of treatment, just like if you've got diabetes, there may be some really intensive work that's done in the beginning to help you get your blood sugar normalized, figure out how to integrate lifestyle, exercise, diet, medication, follow up with the doctor. After that, you may only have to follow up a couple of times a year. So you need to be realistic in accepting this is a chronic illness, and just like you need checkups for your diabetes or your hypertension, you need checkups to make sure that you're still on track with your addiction recovery and your treatment plan.
Right.
And that is why this is an ongoing, why we don't have graduations or certificates of attendance at the Atlanta Healing Center, because you don't graduate from diabetes and you don't graduate from hypertension or asthma or COPD, but you do become more and more successful at managing it, recognizing when you're having trouble early, and seeking and asking help.
Well, and one thing that I see often is when a person has not had a slip yet, they've maybe gone down the slope a little ways, and they catch themselves, and they make an appointment to see you or to see David, and they kind of come in for a little recovery reboot. That's really, really helpful for folks. It scares the family a lot.
Right.
But that's where it's really important that the family learn about the disease of addiction and understand that that doesn't mean they're going to relapse. That means they're stopping a relapse from occurring. So
exactly.
it's a really good thing that they feel confident
the other
to talk
thing
about
is
it.
that no matter how good your recovery is, at some point in time you're going to deal with pain, whether it's physical
Absolutely.
pain from an accident or an illness or something, or emotional pain from a loss. And if you don't deal with that pain appropriately, you're probably going to medicate it in some self-medication sort of way that's not healthy. And so being able to come back and find out, talk about what's going on and get appropriate referrals or at least support in dealing with it will help ensure that you're taking care of yourself in the long run.
And the family program is free for as long as it is beneficial to somebody, because families need support too.
Absolutely.
So we wish you all a happy 4th of July, and we look forward to seeing you next week on Detailing Addiction.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Perhaps you are struggling to cope with the disease of addiction. If not, you probably know a family member or friend that needs help in battling the cravings and the personal and professional damage done by the effects of drugs or alcohol. Get a pen and paper and be ready to write down the following. These are the issues that the trained staff at the Atlanta Healing Center address and treat every day. Their doctors and counselors with over 40 years of practice in the field of addiction